So if a patient goes to you and they're currently wearing a denture, or you can't save their teeth and they need a full mouth of extractions, what are the options in your office when it comes to dental implants?
So if someone has a full denture, I think that the minimum that you want to be able to do is at least 2 implants. So 2 implants will at least keep the denture from flopping around. So we say it's like tying a boat down with 2 ropes.
It's like a snap in, snap out kind of thing.
Right, so it would snap on the 2 implants. There still could be some movement in the back, but at least gives you something to work with. You know,
Okay.
The denture on the top typically works decent if you put some adhesive on it. The bottom, it just goes everywhere. And if you can adhere it to something, that's a good start. So that can at least get you chewing basic foods and things like that,
Okay.
and improve your chewing efficiency a lot more. The next step would be to add a couple more implants. So go into that 4-legged table. You know, if we could have it snapping onto 4 implants, we can keep it moving. So again, using the boat analogy, imagine if you tie a boat down with 4 ropes, it's going to be a lot more effective.
So they could eat and chew a lot better with the 4 implants, snap in, snap out.
Right.
Okay.
And the great part about it is you can remove it, you can clean it. So a lot of patients, especially patients as they get older, if they are concerned about being able to clean in certain areas, some people, they have problems with their hands, being able to hold basic things like a toothbrush. Some of those people, it is better to have something that's removable.
Okay.
The majority of our patients, though, want to have something fixed that doesn't come in and out. So when we go to a fixed type of implants, we need at least 4 implants. Sometimes more, depending on the person's bite and how strong it is. But if we are going to start, we're going to have at least 4. At that point, we can fix it to the teeth.
It's like a full arch of teeth,
right,
that are like in there.
Exactly.
Okay.
So there's no palate, there's no extension of the gums that come up in between your front lip there, and it feels much more and looks more like a natural teeth. It feels like new teeth. It feels like fresh teeth. So.
And you can eat whatever you. How soon can you eat after it's all done?
We always recommend going with a sauce diet while the implants are healing. But once the implants have healed, you can eat right away. You can eat anything that you want. So,
like steaks, corn on the cob, whatever.
Corn on the cob, nuts. I think that's one of the ones people love the most that they weren't able to eat before. Salads.
What's your oldest patient that ever had this done? Got upper and lower new set of teeth.
The oldest patient that we've had it done was in his 90s. So
really?
He was 92 years old. So he, and he wound up living over 100 years old. So, it's.
So it doesn't matter the age. So if somebody's 80 and says, or 75 and says, I'm too old,
right,
they're not too old.
Only if you say so. So the old saying that if you're always right. If you say you're too old, then you're right.
Okay.
But that's a mental limitation that you don't have to have.
Okay.
It's your choice. At what point does it become irrelevant to eat and chew? What point do you stop eating 3 meals a day? You don't. Until the day you die. So as long as you're eating and chewing, I think it's important to have good teeth. So.
Now, we should mention your experience, and I'm not trying to side with you here, but you come from a father that was an implant dentist. You said you did implant dentistry since you were 16 years old.
Right. Well, I assisted with dental implants until I went to dental school, and once I did dental school, I did the training underneath him to be a dental surgeon.
But your mind was already around dental implants early on.
Originally, when I was young, I wanted to do anything but what my father wanted to do. I wanted to rebel. But after working with him, seeing what he did, I compared it. I went to work with plastic surgeons. I saw what they did, and I really loved the dental implants. And it had such an impact on people.
Okay.
It had such, and that's really what drew me to doing dental implants. It's fascinating surgery. It's
the happiest group of patients in all dentistry. Like you could do veneers and this, but you give somebody their teeth back, big deal.
Well, it's kind of like with plastic surgery. I mean, you give somebody something, they can change the way they look, but it goes away so fast. But with something like this is so. It not only changes the way you look, but it changes your overall health, your nutrition, your ability to be social. It has such reaching impacts they're unconscious and psychologically subconscious that we don't even realize the impacts we're having.
Now, if you're in your 80s. Research shows that people are on 4 medications on average. Can you work with those kind of people?
Absolutely, yeah. We work with people every day that are on lots of different medications. But, as long as people are stable and they're relatively healthy, if they can get in the car and drive to the office, we can probably do something for them. So.